Hi everybody, Luke here. For the record, Luke's only the name I'm going by for now. I'm not sure what I'm going to be permanently, or if I'm just going to go back to my birth name, which is gender neutral. I don't know. So, just got off the phone with both my parents. We were on the phone for about 45 minutes talking about the phone call I'm going to have with the doctor tomorrow. I'm trying to get this. There we go. That's kind of good. I'm centered. So tomorrow is the phone call with the doctor. And I have written up this list. I think it was just 2 pages. Yeah. So I've written up this list of things that I want to know about. And I'm doing my best to remain impartial because my parents don't like the idea that this is something I want to do. You know, when I'm not on the phone with my parents, I really, really, really want to be on testosterone. When I'm on the phone with my parents, I do my best to remain impartial and understand that I am idealistic about getting on testosterone right now. And I'm telling my parents that one of the reasons I'm gaining information about this from this doctor is so that I can get a more realistic grasp on what testosterone is going to do. My parents think that this is just an aesthetic thing. Like, I want to be on testosterone because I think it'll make me happy. You know what? I don't know if it'll make me happy. And I told them, my cat just, she clawed my foot. That hurt like a son of a bitch. Stop it. Where was I? My conversation with my dad the other day went pretty good. He, seemed to be open-minded. And we were talking about talking to the doctor. But then when I spoke with him earlier tonight, he kind of changed his tune. And one of the things I've noticed is when I talk to my mom by herself, or I talk to my dad by himself, the conversations go smoothly and adult. As soon as both my parents are on the line, or my parents and my uncle are all on the line, it's like a madhouse. They're running off of each other, they're talking over me, and I can't get a word in edgewise. They're making speculations, they're answering for me, and they ask me a question, and then when I go to answer, they start talking over me. Like, they interrupt me. I listen quietly while they talk. I hear everything they have to say, and then I go to answer, and then I get 2 words into it, and then they start talking over me, and I'm like, my turn now. I love my parents. I really do. I mean, other than the subject of testosterone is what we're talking about, this is typical my parents. You know, they just feed off of each other, and it's, most of the time I just sit back and smile and nod. 'Cause, like, my dad will be saying something to me about how to have a job interview, and I'll go, yes, Dad. Yes, Dad. Yes, Dad. And then I get off the phone, and I live in Washington, and they live in Wisconsin. So I just say, yes, Dad, smile and nod, and then I can do my thing. But I can't do that with this. I can't say, no, Dad, I will not get on testosterone. Yes, Dad, I will honor your wishes. Because if it actually happens, they're going to know. It's not something I can hide from them, and I don't like keeping secrets. So, some of the things I was going to talk about, well, my parents, I told my parents that I wanted to learn about the cons of being on testosterone, how it affects the liver, the heart, sterility, cancer risks, hepatitis, that can be a risk of being on testosterone. I wanted to know about the risk of headaches, and retention of knowledge and confusion was one of the side effects that one of the websites told me about. And then I also wanted to know about, on the lesser side of things, acne, not really concerned with that. I wash my face. But then I was curious about its effects on depression and anxiety, which I have. And just for shits and giggles, I have bad teeth. I have a toothache. I had a toothache at the moment I wrote this, so I'm curious if testosterone will affect my teeth at all. And I wanted to know how it would affect my mood with irritability, depression, mania, anxiety, uber relaxation or confusion. And I wanted to know how it would interact with the medications I'm on. And I listed those, and I even put ibuprofen, Benadryl, and daily vitamins on there, because who knows? Better to be safe than sorry. And then my parents asked me, okay, those are all the cons, what are the pros? And they're expecting me to draw a blank. And I said, well, pros, facial hair, more masculine jawline, losing the hair up here, a deeper voice, and faster muscle mass and no menstruation. And they go, those aren't pros, those are just side effects. And I'm like, you guys asked me what I thought the pros were. Those are my pros. Those are the things that make me want to take testosterone. So it's going to be an uphill battle with those two. But my father is going to be on the phone with me tomorrow when I talk to Dr. Bosted. And some of the things my father contributed to the question is my family history. Apparently I have a family history of diabetes, mental disorders like schizophrenia, high blood pressure, high cholesterol, hardening of the arteries, and congestive heart failure. And my brother has Asperger's syndrome, which is a high-functioning autism, but I don't think the testosterone is going to affect that. I don't think I'm going to all of a sudden develop autism. And then also my father was curious about what's all involved in the psychological evaluation before someone takes testosterone, how long the waiting period is, and under what circumstances would a patient be denied testosterone, which I think are good questions. And it was after that the conversation started going downhill. So that's where I'm at right now. I really, really, really want to put the conference call on speakerphone and videotape the whole conversation. But unfortunately, I can't do that because I make these videos on my phone, and the conversation is going to take place on my phone. So if I can borrow somebody else's phone or somebody else's camera, if I can figure something out so that I can videotape the whole conversation so you guys can hear the doctor's answers to my questions, that would be awesome. But I don't think it's going to happen. So, okay, that's what I got right now. If anybody else can think of any questions that I should talk to the doctor about tomorrow, please let me know. Yeah. And also I want to know how soon I would grow facial hair, how soon my voice would deepen, how soon my period would stop, and how soon my muscles would start to get bigger when I work out. I view those things as pros. I do. I'm willing to work with the cons, because for me those pros outweigh the cons. So that's where I'm at. Signing off!